Hello everyone, my name is Angel Phillips and today I will be presenting on reducing health disparities in the acute care setting through nurse practitioner-led interprofessional teams. Health disparities remain a major challenge in hospitals across the United States, and acute care environments present unique opportunities for nurse practitioners to lead improvements in access, quality, and safety. This presentation will introduce a proposed NP-led initiative designed to close equity gaps and strengthen patient outcomes. Medicaid and uninsured patients experience some of the most significant health disparities in acute care. These disparities stem from factors such as limited access to primary care, delayed presentation due to cost concerns, and social determinants of health like transportation, food insecurity, and unstable housing. Nurse practitioners with advanced clinical and leadership skills are well positioned to lead interprofessional teams in addressing inequities and improving outcomes. Today, I will describe the need to outline a proposed intervention and review its cost implications. In acute care, Medicaid and uninsured patients face poorer outcomes than privately insured patients. Common disparities include higher rates of preventable hospitalizations, reduced access to timely diagnostics or specialty consults, lower likelihood of receiving guideline based care, and higher readmission rates. Uninsured patients often delay seeking care due to costs, resulting in more severe illness when they finally present. Medicaid patients frequently encounter challenges securing post-discharge follow-up due to limited provider availabilities. These inequities contribute to increased morbidity, mortality, and hospital financial strain. Nurse practitioners can play a crucial leadership role in addressing these disparities. As primary clinical decision makers and care coordinators, nurse practitioners can integrate physicians, social workers, care managers, pharmacists, and case managers staff into a unified approach. Nurse practitioners are skilled at assessing both medical and social factors influencing care. By leading standardized care pathways, improving communication, and advocating for equitable resource allocations, nurse practitioners can significantly improve outcomes for Medicaid and uninsured patients. To address these disparities, I propose an NP-led Health Equity Rounds program. This model introduces a structured daily huddle focused specifically on identifying and addressing disparities among hospitalized patients. During these rounds, the NP leads a discussion with the interprofessional team to identify patients with unmet social determinants of health, communication barriers, or inequitable access to care. This includes ensuring interpreter services are scheduled, coordinating rapid results, and activating support services such as social work or case management. The ultimate goal is to create a proactive rather than reactive response to disparities. The workflow begins with a brief morning huddle led by the nurse practitioner. The team reviews patients who may be at higher risk due to language needs, lack of primary care, homelessness, transportation problems, or limited health literacy. Once identified, the nurse practitioner coordinates targeted interventions. Social determinants of health screenings are completed early in the admission. The nurse practitioner assigns team members responsibilities such as scheduling interpreters, arranging follow-up appointments, or connecting families with community services. Daily evaluation ensures interventions are working and barriers are resolved. At the end of each shift, the nurse practitioner conducts a quick reflection with the team to reinforce learning and adjust the plan as needed. In this SWOT analysis, we identify the internal and external factors that may influence the success of the program. The strengths are the nurse practitioner brings expertise in holistic assessment, leading communication, and care coordination. The program aligns with hospital missions to improve equity and reduce uncompensated care. Weaknesses include staffing shortages, which may challenge daily huddles, and some members of the team may have limited experience with insurance barriers. Opportunities are federal and state initiatives increasingly support Medicaid expansion, care coordination programs, and hospital equity initiatives. Partnerships with community organizations could strengthen transitions of care. Threats: Medicaid reimbursement rates could be low, and hospitals may face financial pressure from high rates of uninsured patients. Additionally, staffing turnover could disrupt implementation. While this program has some upfront costs, it is designed to ultimately reduce the financial burden associated with high utilization Medicaid and uninsured patients. Startup costs include staffing, training on Medicaid eligibility, cost of care discussion, and social determinants of health screening, estimated at approximately $3,500. Technology adjustments to flag insurance statuses and prompt referrals may cost around $1,000 to $2,000. Operational costs are modest, with nurse practitioners dedicating about 10 to 15 minutes per day to lead the huddle. Cost savings can be significant, reducing readmissions, avoiding unnecessary EDUs, and preventing delayed care, all reduce uncompensated care costs. Additionally, assisting eligible patients in obtaining Medicaid can decrease financial losses for the hospital and increase continuity of care. If implemented effectively, the NP-led program is expected to improve several key outcomes. Communications for patients with limited English proficiency improves through proactive interpreter scheduling. Culturally competent care increases patients' trust and engagement. Discharge planning becomes more equitable and consistent, reducing preventable readmissions. Quality metrics such as pain management, timely testing, patient satisfaction should improve. Additionally, interprofessional team cohesion and job satisfaction are likely to rise as the team becomes more unified around equitable care goals. In closing, health disparities in acute care pose significant risks for vulnerable patients and financial challenges for health systems. Nurse practitioners are uniquely suited to lead cross-disciplinary efforts focused on equity, communication, and quality improvement. The NP-led Health Equity Rounds program is an evidence-based, practical, and cost-effective strategy that addresses disparities through teamwork and targeted interventions. By integrating equity into daily practice, we can significantly improve outcomes, enhance patient experience, and support organization success. Thanks for listening.